Yeah, meniscus compression test. So we just lift up, help your hands to stay relaxed up, hold the tibia, and then just like going down directly to the knee joint, up 落去. Okay, just you can also use your body weight if you want. You can use your body weight to transfer some of the weight. Okay, and then trying to push downward. Sometimes you can also add some rotation to test the meniscus, right? You can having different direction, or you can add some rotation to test which horn of the meniscus is injured, right? So you can use the compression. It is kind of assessment technique to trigger the pain. So if he or she is having pain, it can identified as maybe meniscus injury, maybe OA, maybe any kinds of joint problem. Okay, so you try to compress the tibia and femur together. You try to up to see whether you have some pathology. Okay，即係你就係咯，係啦，即係你就係睇一下噏唔噏得痛佢。你正常一個健康嘅呢種你噏唔痛佢噶嘛。如果佢啲 meniscus 係健全嘅話，okay, so if he or she is having good knees, good joint capsule, good meniscus, if you try to compress it, he won't feel pain. But if he or she is having maybe meniscus tear, maybe some meniscus injury, 可能係花咗嘅啫。Not likely tear, but the meniscus is having a little bit like strip, so you will also feel pain around there. Or if he or she is an elderly, okay, 公公婆婆, okay, so if your grandma complain, oh, some pain inside my joints, we also use compression test to test whether he or she is having joint capsule problem or OAE problem. Okay, so you can use your body weight. Use your body weight on the plantar, or you can just use your pec major to push it. Okay, so push it to transmit the weight on the knee joint in a prone knee flex position. You can either do it in 90 degrees or in less than 90 degrees. Okay, so compression. It is not a treatment. It is a assessment technique. Okay. So PFJ, so PFJ, we usually use a bolster to support the knee a bit, because if you are locked into an extended position, your patella will be sink down. Okay, so if your patella sink down, you can't move it. Okay, so let the knee rest into a resting position 10 or 20 degrees of flexion so that you can easily mobilize it. Okay, and then if he or she is having very tight quads, you can just do the quad first, right? Because the quad is directly attaching to the quadricep tendon, patella, then go to patella tendon, then go to tibial tibial. So sometimes if he or she is having patella problem, PFJ problem, you can just go for soft tissue release first instead of directly going to mobilization. Okay, if the muscles is rubbish, the bone will be in rubbish position. Okay, so why don't you treat all the soft tissue first instead of you are dealing with the bone? Okay，即係呢個都係一個即係頭先講嗰樣嘢啦，就係、你去 treat 一個痛嘅時候，因為 practical exam 都係嘅，佢俾個 case 嚟。佢一個 injury 或者一個痛症。So for practical exam, it is a case, not a real case, but we make up some case of having some injuries or pain. So for practical exam, you directly plan for peripheral manual treatment, right? But for real patients, when you are dealing with your intro clinic section, you're dealing with real patients, they are having real pain. You need to think about the whole picture instead of a individual treatment technique. You know what I mean? So for a real treatment, okay, you may want to go for quads. You may want to assess the quad first, any tightness or any imbalance between the quads, so that you can have a very precise treatment to the patella. Okay, so you may want to do something on the quads, then you may want to do the accessory movement of the PFJ. So very simple. Patella. I think everyone can locate the patella. If you can't locate patella, see you next year. Okay. So we can do it either superior, inferior. We can either do it medial lateral, or we can do it compression or distraction. So 3D, very 3D. So because it is a sesamoid bone, okay, it can be moved in any direction. So not only in superior, inferior, you can have a little bit diagonal direction if you want. Okay. So superior, inferior. So because when you extend the knee, okay, your patella will be popping superiorly. Okay, so because your quad is pulling, shortening, okay, is pulling in this direction, so the patella is popping upward. But when you flex, the patella is moving downward, okay, because your quad is lengthening, and then so just assess which direction you want. So if you want to improve the flexion of while the PFJ is moving, you want to glide it inferiorly to help the flexion, right? So you need to know, okay, to improve which mechanics when you're doing the gliding. You can do general gliding like this, superior, inferior for a general mobilization, but most of the time you need a precise, you need to have a very clear target for which range of motion you want to improve, okay? So if I want to improve flexion, I will just wrap around the patella, okay? Then just push down, okay? Just push down. You see it? So we can divide it into grip 1, grip 1, grip 2, grip 3, and then grip 4 we push all the way, then we do it like this. Okay, so just wrap around. You can either use one hand, okay? But for professionalism, for your appearance, don't do it like this. Okay, stabilize the tibia a bit, stabilize the patella. Okay, make sure it is stable. Make sure no rotational movement. Then we can do the mobilization. Okay, so just like when you're doing massage, don't do it like this. Okay. Stable, and then you do the massage efficiently, okay? It is all about your professionalism, your appearance, and also the stability of your patient, okay? So also for mobilization, because the bone is moving, you need a very stable environment for the bone to move, okay? So inferior glide, 我好少會叫咩 longitudinal 咩 calflet call that 好 confusing. So very confusing. Calf leg, call that very confusing. We just do inferior gliding. That's all. Okay. We use the anatomical terms to describe the direction. Okay. Or we do superior gliding. So we just wrap around. Okay. Stable a bit, and then we try to push upward. Push upward. Okay. Remember, you are just pushing upward. You are not compressing. Don't compress. Okay. If you compress, then glide. Your plica underlying the patella will be clicking around, will be rubbing around, and then you will harm the PFJ. Okay, so don't compress. Just wrap around the bone. You're not compressing. You wrap around the bone and then push it. Okay, push it. Okay. 即係都其實都呢嗰啲嘢冇乜 technique 可言嘅，揾啱位箍住佢跟住推咯，係啊，冇 technique 嘅，其他仲難 ，ankle 嗰啲仲難。shoulder 呢啲仲難係啦，咁啊呢啲就冇乜 technique 推係啦。Okay, so if I put it downward inferiorly, actually I am also lengthening the quadriceps tendon. So sometimes if I'm dealing with like very tight quads or having quadriceps tendinopathy, I will use this kind of patellar mobilization to work on the tendons, to work on the neighbor tissues. Okay, so you are not only moving your PFJ, but you are also mobilize a bit of the soft tissue in between. Okay, so a very useful technique, inferior, superior. Okay, then we can also do medial and lateral transverse movement, which is like this. You just locate. So we have patella. It is just like a square bone, right? So you can differentiate 4 corners. So 4 corners. So you use 4 fingers to locate the corners. Then you can push. Can you see it? You can push. Okay? So you can push it here, or you can push it laterally. So you use 2 fingers to squeeze it. Just use 2 fingers to squeeze it. Or in general, you can do it like this. Okay, medial lateral, medial lateral, medial lateral. Okay? So if someone is having rubbish VMO, poor patella tracking, and then it develops a PFJ syndrome, okay? So you can use this kind of mobilization to help them. Okay? So very simple. Locate the corner, then push. Locate the corner, then push. Okay? 都冇乜手法可言嘅，你揾啱個 anatomy 個位咧，咁你推就係。因為你 patella 冇理由揾唔到啦，揾唔到燒 next year 啦。Okay? And also compression and distraction. So compression, just use your palm, okay? Make it relax, okay? And you try to use the palm to cover all patella. Then you try to push it downwards, just push it downward, okay? If he or she is having PFJ problem, placa, okay, those kind of problem, maybe sometimes fat pad, he or she will feel pain. Okay, so you just directly compress. It is an assessment technique. Okay, pay attention. If you are not stable enough, the patella will be sliding. You'll be sliding like this. Okay, it is super not comfortable. Okay, so please be ensure you are fixing the patella, but not gliding like this. Okay. Okay, don't glide it during compression. Just do the compression. Okay. So for assessment, and then destruction, very simple. Locate the 4 corners again. Then you try to just like 夾公仔, okay, to squeeze the base of the patella, and then you try to pick it up. Just like you are doing picking up massage. Okay. Locate all 4 corners, then pick up. Okay. Or someone will use, okay, the squeezing techniques. Okay. 夾住佢. Okay. Stable. Okay. The margin, the boundaries of the patella, then you squeeze it up. Okay. 即係你就好似騎起佢咁樣。So you can either use your fingers, but sometimes fingers is not powerful enough. So you can use your palm to squeeze it up. Okay, to track it, to distract it. Okay， 即係咧，其實你真係揾到咧，係啦，揾到嗰個位咧，其實基本上都冇乜手法可言嘅，係啦，膝頭哥係簡單啲嘅，係咪？咁所以大家可以玩下啦。So we have lateral medial, we have compression, depression, and also we have the inferior and superior glide, right? And this is some demonstration photos, so you can use either hold hands to push it, or you can use the finer eminent to push it. 即係你自己中意啦，係。但係咁樣咧，多數有啲咩問題咧？就你就好容易 compress 到落去。So the problem of using palm because you will easily compress. So I suggest you using the 虎口啦, okay, the finer eminent over here to use your palm, but not compressing. Okay， 即係你哋自己揀啦，冇乜所謂。總之你唔好撳到落去就得嘅。So uses of patellofemoral joint longitudinal movement. So this is your patella. So under your patella, you have a lot of soft tissues over there. Okay. So if he or she is having chronic PFJ pain, it can be OA. Okay. So in combination with compression or distraction as progression of the treatment. So you may want to use compression to assess whether the cartilage, the placa over there is healing or not. Okay. 即係其實你去 compress 佢咧，即係譬如可能你第一日 treat 佢嘅時候，一撳佢就好痛啊，咁啊超痛啦。 跟住去到可能你同佢練下，又同佢摸下，有啲有路咁樣做下。可能第5個 session 你撳佢嘅時候，咦得翻少少啫喎，得翻1分痛啫喎，咁你有 improvement 咯。咁呢個係一個 assessment technique。So you can see the progression of the clients, especially for the pain level of the compression PFJ. Okay? So compression, directly you can see use the palm and then going downward. If you do not have the bolster, you can use the hand to support. But if we have a bolster, you can directly compress, okay? Because the bolster, the pillow will be having the cushion for you, okay? So, but beware because you are directly stretching inferiorly, so you need something to support the knee, okay? This is very important for patient position, especially when you're dealing with real patients. If you're going to intro clinic, they're real patients. You don't want to harm them. So, good pillow positioning, good bolster positioning is very, very important. You don't want your patient to be placing in a hyperextended position. You don't want your patient placing into a very weird lying position, okay? So make sure you are having good pillow, okay, position, okay? Supporting knee joint, supporting ankle joint, whatever, okay? So distraction, you can either use the finger techniques, okay, 4 corners then distracting, or you can use the gap, okay? Use the palm to pick it, just like picking up of the massage technique. So you can use either A or B, okay? So it is also a very good pain relief in chondromalacia patella. So if he or she is having chondral problem and you want to relieve some pain, you can use this distraction method. Okay? So medial laterally, so if he or she is having patella tracking problem, is having PFJ problem, you want to having some pain relief, you can use the transverse mobilization technique. Okay. So some for superior pivot joint, I want to explain the theory first. So here you can see to improve ankle dorsiflexion. Why it can help ankle dorsiflexion? 你可以坐喺度睇喎，如果你睇到。Okay. So this is the distal one, right? Which is the ankle one, ankle pivot joint. And then this is more near to our knee, right? Which is superior pivot joint, or we call proximal pivot joint, right? So we do AP in distal, right? So we do it like this. So we do it like this, right? So we do it like this, right? So in last lesson, 係咪先？你記唔記得個 AP 先？咁啊 AP 係咁喺度撳啦，咁啊幫佢咩啊？幫佢多時啦，係咪 ？So it helps the dorsiflexion while I'm doing the distal AP. Okay. So the bone, the fibula is moving for distal. It is moving here, right? So it is moving this direction. How about if I move, because this is a very relatively long bone fibula. So, but if I try to, just like this is the fibula, okay, this is the ankle end, this is the distal end. So I do AP, which is I'm doing like this, right? So because of the lever arm, you can see, because the bone is super long. When I push down AP, can you see the tip end over here? Going, yes, going upward. Okay, so AP. So, but for the proximal end, it goes PA. Can you see it? So this is the ankle. Okay, ankle, right? If I do AP to increase the dorsi, the proximal end comes out, which is doing kind of PA direction. Okay, so in these circumstances, if I don't want to move here, I can move here to move the distal part. Do you know what I mean? Lever arm 槓桿原嚟㗎嘛，得唔得？因為佢條骨其實好鬼長，你都喐少少咧，其實佢都會有少少槓桿原理咧，想向前，得唔得？就好似有少少好似搖搖板咁啊，你喐呢度，咁呢度咪趌起咯，係啦。 咁啊成條都會上去。咁點解咧？所以點解 superior fifth joint 係做 PA 咧？係做 PA 咧，就係咁解。So that's why we do PA in superior fifth joint instead of AP. Because if you do AP in superior fifth joint, your distal fifth joint will be going PA, so which will affect your the mobility of the ankle joint, of the syndesmosis of your distal fifth joint. So if we want to improve dorsiflexion, we do AP in distal, right? Okay, but for proximal we do PA. Okay, so very simple. We do it here like this, right? We just do it here like this. 我哋可以鬥佢嘅，得唔得？ So we just pull the fibula, or we can do it in sideline position. We can do it in a push. Okay, so push position. Either two is fine. Okay, but I think the push, sideline push is more effective, and more save your force. Okay, save your stamina. So we can do it like this, sideline push, or we can do it like this. Okay, we can push it, and sideline you either use palm or we can either use fingers. If he or she is think that, oh, my fibula very bony, because head of fibula often very big bone, big bony landmass over here. If you use finger,